Everyone, this is Ben with Preauricular, and in this video I'm just going to talk about an ear pit. And the reason I wanted to make this video is because I actually wrote an article on my website a few years ago that got a lot of traffic, and it was just about this little hole I have in my ear called an ear pit. So I thought, why not make a video and just kind of show it up close and talk a little bit about it. So mine's actually called a preauricular ear pit, and all it is just a little hole right here at the front of it, and it kind of looks like I've had my ear pierced there or something. And I'll kind of get up to close to the camera. I'm not sure if it'll show up well, but this is what it looks like. It's just a little hole right there into my preauricular area. And people can have also ear tags, which are these little bumps right before their ears. So ear pits, ear tags are fairly common. Some people have them in one ear, some both ears. And so it just really depends. Mine never really hurts. Every once in a while it'll fill up with a little fluid, and if I kind of press on it, a small amount of fluid will come out of the hole, probably from where I get in the shower and everything, and maybe a small amount of fluid collects in there. Usually I'll clean it every once in a while by pouring peroxide in it, usually when I'm cleaning my ears out, and I'll pour a little peroxide or alcohol in it. Sometimes it'll kind of bubble up for a second, and that's all I'll really do. They can be connected to your sinuses, and so that's something that you want to keep in mind. The ear pits usually form during fetal development, and they're fairly common. What happens is when you're forming in the womb, the ear pit or sinus just doesn't really fully close and form properly, and that's all that is. It just never really sealed up. Some people have it in one ear, some people have it in both ears. Some people can have both ear pits and skin and ear tags. They're usually about 1/4 of an inch to maybe an inch deep. That's the average depth of the ear pit. They can become infected, and if you have a problem with recurrent infections, you can actually get your ear pit removed if you want. And it's just a simple surgical procedure where they go in, they'll cut out the entire pit and sew your skin back up. And that's something you may want to consider, again, if you have problems with it becoming red, swollen, irritated, draining excessive amounts of pus or anything like that. I guess I'm blessed. I've never had that problem so far. I'm 32 years old. I've never had that problem. So if you have ear pits, you may be at a higher risk for other congenital defects. And that to me is sort of the weird thing about it when I read about them online. And this seems to occur in people who have, especially you're at a higher risk if you have multiple ear pits, like if you have one here, or if you have an ear pit and an ear tag. And the reason you're at a higher risk is because whenever your body's developing in the womb, the genes that are responsible for your ear pit section that causes it to formally form and close with the sinuses and the ears, those same genes are also responsible for other body part developments. And so what can happen is, if you have a problem with your ear pits, you may notice also a problem with your kidneys. That's the organ that usually is most commonly associated with ear pit problems. And some people with a lot of ear pits or ear pits and ear tags can have kidney trouble, such as they'll be born with one kidney, or they'll be born with no kidneys at all, which is surprising, or they could even have both kidneys, but they have a lot of kidney abnormalities. So if you ever have kidney pain and you have an ear pit or an ear tag, then there could be an association with it. Now that's not always true. As far as I know, I have perfectly healthy kidneys. I've never had a problem with kidney trouble. Every time I've ever had a checkup, my kidney functioning was always fine. So I don't think I have any issues there. But if you have problems with your kidneys, then that's something you may want to keep in mind if you have a little bit of an ear pit. So I don't want to alarm anyone. I just wanted to make you aware of that. So that's all I know about ear pits. Thank you so much for watching this video, and have a great day.